Hello. This week we are talking about a common and potentially severe complication that affects up to 1 in 7 new moms after they give birth, and that is postpartum depression.
Yeah. This topic can be really challenging and even painful for some to discuss, giving us even more reason to share with you this week. And it's also one that is very near and dear to our hearts for multiple reasons.
So with that, we're really glad you're here at our channel where we share medical educational videos about all things related to pregnancy, postpartum, parenting, and beyond while sharing our own real-life pregnancy and parenting experiences.
Yeah. And just in case this is your first time meeting us, I'm Kurt. I'm a board-certified pediatrician.
I'm Sarah. I'm a board-certified OBGYN and mom to 2 toddlers.
And we are the Doctors
Bjorkman. Welcome back. This week we are talking about postpartum depression or PPD, and it is not lost on us that if you are watching this video, you may be worried about your own symptoms or the symptoms of someone you love. Or maybe you're pregnant now and worried about your risks of postpartum depression and want to know if you can decrease your chances of having PPD in the future.
Yeah. Now, PPD is incredibly common, yet it's still surrounded by stigma and misunderstanding. Our goal today is really just to break down what PPD is, why it happens, how to know your risks of postpartum depression and limit them, and most importantly, how to seek help if you or someone you love might be experiencing it.
Let's start with the basics. Postpartum depression is the most common complication for women who've just had a baby. As we said, it affects up to 1 in 7 women, or about 15%. For half of women diagnosed with PPD, it's their first time to have depression. This mood disorder affects individuals within 1 year after childbirth. And it's important to note that it isn't just the baby blues, which many women experience, and this typically goes away within a couple of weeks. Postpartum depression is more intense, lasts longer, and can seriously impact a mom's ability to care for herself and her baby.
Yeah. Now, symptoms of postpartum depression include persistent sadness, lack of interest, low self-esteem, sleep disturbances, loss of appetite, anxiety, irritability, maybe with the potential of harmful attitude towards your baby, self-blame, feelings of humiliation. Also, some may experience things like changes in sleeping, eating patterns, difficulty bonding with their baby, thinking about hurting themselves or their baby, feelings of hopelessness or worthlessness.
It is so important to recognize and address postpartum depression because it is crucial for the health and well-being of mom and their baby. If left untreated, PPD can interfere with the ability to care for your child and may contribute to long-term developmental issues in children, and PPD can put strain on family relationships and increase the risk of suicide.
Now, you mentioned something like baby blues. What's the difference between that and PPD?
Sure. So baby blues are feelings of sadness that you may have in the first few days to weeks after having a baby. Up to 4 in 5 new parents have the baby blues. This can affect any new parents, regardless of race, age, income, culture, or education level. Most people experience the baby blues 2 to 3 days after the baby's born, but can really happen anywhere from 2 to 35 days after you give birth. You may have trouble sleeping, be moody or upset, and cry a lot. And this can last up to 2 weeks and usually goes away on its own without any treatment. If you have sad feelings or feelings like this that last longer than 2 weeks, it is so important to talk to your OBGYN or pediatrician.
Yeah, and definitely a lot of these symptoms kind of fall within the realm of this normal transition to parenthood.
Yes.
But the thing here is that it's more than just the normal struggles of transitioning to being at home with an unreasonably unreasonable baby and childhood and doing the parent role. So if you're concerned, talk to someone. What does cause postpartum depression?
The exact cause is not fully understood, but some potential underlying causes that could contribute include some of the hormonal changes postpartum, a genetic predisposition, as well as psychosocial stressors. There is a rapid drop in estrogen and progesterone with delivery. You couple that with the stress and sleep deprivation that often comes with caring for a newborn, and this can trigger a depressive episode in susceptible people. So let's talk about how postpartum depression is diagnosed and treated.
Yeah. Now, ACOG, the AAP, and the AAFP all recommend screening every patient for postpartum depression, and it's recommended that screening be done both during pregnancy and postpartum. So you'll likely fill out one of these screening questionnaires multiple times.
Yeah. There are several screening tools available, but the most frequently used is the Edinburgh Postpartum Depression Scale, or the EPDS. This is a 10-item questionnaire completed by patients, and it only takes a few minutes. A score greater than or equal to 13 is associated with increased risk of developing postpartum depression and should trigger more clinical investigation. The goal of that further evaluation is to make the diagnosis, assess for suicidal and homicidal risks, and rule out other psychiatric illnesses. So, I was really on the struggle bus for my second postpartum journey. And was very surprised by that. My first pregnancy, delivery, postpartum was kind of uneventful, what you'd expect, challenges of becoming a new mom and adjusting to all that, but for the most part, felt mentally well through those challenges. With this second postpartum sweet baby beau, I found myself really not having a good time most of the time. I was in tears, sad, not feeling like I was capable of taking care of two kids, the newborn baby and the not quite 2-year-old, and like was very overwhelmed. The thought of like being at home with just the two of them by myself was just overwhelming. Like I couldn't be at home with two kids by myself. It was just too much. I couldn't handle it. And I remember going to the OB or to the pediatrician and filling out that postpartum depression scale. And I grade these. So I answered and my score was a 0. But had I filled it out honestly, my score was a 10. And so while I did not quite meet the criteria for postpartum depression, it certainly is a spectrum, and I was not thriving by any means. And that's interesting for a couple reasons. One, because I am an OBGYN. I know postpartum depression is a disease. There is no shame here, but I still didn't answer honestly, and I think that speaks to the stigma that still exists around this. So anyway, I think that it was a variety of things. I don't know, Kurt went back to work way earlier postpartum with this pregnancy, so I was home with both of them solo much sooner, and I definitely felt alone, and I just felt so very alone with these two little kids, and it was really hard, and the baby didn't sleep, and the not quite 2-year-old had just as many emotions, and nobody wanted to nap, and I just did not feel like myself. And I also was kind of on an extended maternity leave because we knew that we were transitioning jobs. And so I think part of it was, my identity. I love being a mom. It is my favorite job. It is the most important job. But I also really love being a doctor. I love being an OBGYN and a fertility specialist. And so to not also have that piece of me that I had been doing for so long and was such a big part of who I was, balancing with this role of now we have two humans to keep alive. And I wasn't living my best life by any means and had a hard time asking for help. And I remember being on the phone with my sister one night in tears, and she just, they had been around for help, but this was not a long-term solution, and she just said, you have to figure this out. You need to ask for help. You are not doing well. And that was kind of like our wake-up call to, hey, we need to figure something out because I am, again, not having a good time. So I think, you figure out those solutions and what you need for support. But no, like this was me who I didn't have postpartum depression. And then there's the spectrum of like, you do, and you can't just pull yourself out of it. You need help and possibly therapy and possibly medication and these other things. And so my plea and hope for you is that if you find yourself in this position where you don't feel like yourself, you're sad, you are not living your best life, talk to a close friend, talk to your OB, talk to your pediatrician, just tell someone that you need help and they want to help and support you to recover and be the best parent that you can be.
Okay, so now this is kind of the key question. What should someone do if they think they might have postpartum depression, and how would they be treated?
If you think you might have postpartum depression, see your healthcare provider right away. This can be your OBGYN, your primary care doctor, your baby's pediatrician, your therapist. Just let someone know that you are struggling.
Yeah, and then that provider will ask you questions about how you're feeling. If your feelings are causing problems with how you're able to care for yourself or your baby, and you'll likely fill out one of those EDPSs at the time.
Yeah. Your provider may also do tests to see you have other health problems that could lead to postpartum depression, including checking your thyroid.
Yeah. Treatment for postpartum depression can include therapy, medication, or a combination of both. As it is, cognitive behavioral therapy, or CBT, has been shown to be particularly effective with PPD. In some cases, antidepressant medications may be prescribed as well. If you're breastfeeding, there are some options that are safe for both you and baby.
Yep. The first line treatment for postpartum depression is psychotherapy and antidepressant meds, as you said. So the psychotherapy is usually first line treatment for patients who have mild to moderate depression, and a combination of therapy plus antidepressant medications is usually recommended for moderate to severe depression. ACOG recommends using SSRIs or SNRIs. These are things like sertraline, escitalopram, duloxetine, venlafaxine for medication for postpartum depression.
Yeah, and the goal with treatment is remission or resolution of the symptoms of depression. And likely they'll use the same screening tool, that EDPS, again, to track symptoms along the way, with improvement being a score improving by at least 50% or more.
It's recommended that treatment be continued for at least 6 to 12 months to prevent a relapse of symptoms. Discontinuing the medication during pregnancy or in the postpartum period actually results in a high risk of recurrence, and so it's not recommended. It's also recommended to slowly discontinue the medication when it's time, or to kind of taper it off, as abruptly stopping the med can cause some unwelcome, unpleasant complications.
Yeah. We mentioned this briefly, but what about breastfeeding and antidepressants?
Sure. So anytime we talk about being on medications and breastfeeding, you have to include, kind of talking about the benefits of breastfeeding. And then you also have to talk about the risks of that antidepressant use during breastfeeding. Like, are there risks to an infant if they were exposed to that in the breast milk? But you also have to balance that with talking about the risks of untreated postpartum depression. The risk to baby while taking some of these safe antidepressant medications is relatively low, and patients are encouraged to breastfeed while on these antidepressants. And if you are breastfeeding, that factors into your provider's choice of which medication to choose for you, because maintaining that breastfeeding relationship is really important as well. And there are pregnancy safe meds.
Yeah. So two just like big things to start with. The first is, just because you're the partner doesn't mean you can't also have depression. So if you're feeling symptoms that way, get help. Absolutely, you are not immune. I know for us, there was definitely this challenge, particularly with baby number 2 coming home, whether it was the stress of having 2 kids at home or just the changes in my job and my role and my availability to be around to support Sarah was a big challenge for us. Even, and you start to see like, gosh, like this is really wearing on Sarah. This is wearing on my partner. What do I do? And so you start doing all the things you can before you leave for work, trying to have things set up for while you're gone, trying to be home from work as soon as possible and do as much as you can the whole time you're there. And still, sometimes it isn't always enough. And that just kind of goes back to this, like, this isn't just what you're doing. This isn't just a thing of your partner, but that it's more than just like, it's no one's fault, right? Like, postpartum depression is a chronic illness. It's a disease. And so that it may not just be, you can't just work your way out of this, right? Your partner can't just exercise their way out of it. You can't just support your way out of it. And so realizing like, hey, you're going to do everything you can as a partner to support your person. And then also like the best thing you can do sometimes is just to get help and encourage them in a loving, consistent way to say, hey, this is beyond us. Let's get help. As we mentioned earlier, mom's mental health is extremely important, but it's not just important. It can sometimes be a matter of life and death.
A study published in JAMA just in 2024 found that mothers with clinically diagnosed perinatal depression had a 3 times higher risk of suicidal behavior when compared with moms who didn't have perinatal depression. The increased risk was particularly high for that first year after diagnosis, and it remained elevated through 18 years later, and also when compared to some of these patients' sisters who did not have perinatal depression.
Yeah. And another study just from 2022 found that postpartum depression was also significantly related to an increased risk of maternal suicide and was associated with a greater risk of developing other comorbidities like high blood pressure, diabetes, high cholesterol, and stroke.
These findings continue to show us that vigilant clinical monitoring and intervention is really needed for this vulnerable population to prevent devastating and lifelong events.
Yeah. Identifying and treating postpartum depression is life-saving treatment. So we again want to encourage you, if you think you might be having symptoms of postpartum depression, it is critical to seek help.
The pregnancy and postpartum period is extremely challenging, and this mix of physical and emotional change, again, can lead to feelings of sadness and hopelessness, and it might make you feel like you are failing as a mom, or that you're just not bonding with your baby the way you thought you should. But I want to stress this. Postpartum depression is not a reflection of your ability to be a good parent. It's a disease and one of the most common postpartum complications, and you should not be embarrassed to seek help. There's this quote that I think kind of captures it, or that I certainly identified with. And it says, in my opinion, postnatal depression is a rather rational response to being left alone at home with a newborn baby and a traumatized body. And that was very much how I felt that this second go round. But at the same time, know that there is that I'm having a hard time, and this is a disease. And this is beyond the normal adjusting to being a new mom. And sometimes you may need help identifying that. So fill out your questionnaires honestly. Be honestly with your partner and support people in your life. And know that you are not alone and there is help.
Can postpartum depression be prevented?
Potentially. The U.S. Preventative Services Task Force says that certain kinds of counseling or therapy can prevent perinatal depression, including postpartum depression, for women who are at increased risks. And the task force recommends counseling for women with those risk factors.
What are risk factors for developing postpartum depression?
Interestingly, a meta-analysis of 33 studies showed that gestational diabetes, having a male infant, a history of depression, and epidural anesthesia use were possibly risk factors. Clearly, some further research is needed to assess the real significance of these reported risk factors, especially the sex of the infant and epidural use one.
Yeah. Now, there are also lots of other risk factors. Some of these could be depression during the pregnancy itself, or if there was a personal or family history of major depression. Other mental health conditions as well in the past are risk factors.
Yep. A history of physical or sexual abuse, as well as domestic violence.
Yeah. And then things like significant life stressors and being separated from your partner, the death of a loved one, or an illness that affects you or a loved one can increase your risk of postpartum depression, as can things like being unemployed, having low income, little education, or little support from family or friends. Or things like a pregnancy that was unplanned or unwanted, or even being at a younger age, specifically less than 19.
Yeah. Another risk factor, as we mentioned, is having diabetes or having other complications during pregnancy, like preterm birth, being pregnant with multiples, birth defects, or pregnancy loss.
Yeah. And then there's lifestyle things like smoking, drinking alcohol, or using other drugs that can be associated risk factors for postpartum depression.
Things like if you're having breastfeeding issues, trouble caring for your baby, these things are risk factors, as is having a baby that's sick or has other complicating health conditions. You might have negative thoughts about being a mom or having trouble adjusting to being a mom. All of these things are risk factors for postpartum depression.
Yeah. And coming back to other lifestyle factors that can increase your risk of having PPD goes to poor eating habits, decreased physical activity, vitamin B6 deficiency.
So basically everything that is happening during that immediate postpartum period, as Kurt kind of mentioned earlier, when you're dealing with this brand new baby that doesn't want to sleep, you are healing and recovering from delivery and trying to adjust to this new life.
Yeah, which really just kind of comes back to what are the things that are modifiable for you? How can you decrease your risk and even potentially prevent postpartum depression? And of all of these things, one thing that has been shown to actually be protective is exercise. Exercise gives you so many benefits, really decreasing some of the low self-esteem that can be caused by depression, and it just gives off all of those feel-good endorphins and opioids, which really brings on the positive effects of mental health while improving self-confidence and problem-solving capacity.
So even more reasons to exercise.
Now remember, reaching out for help is a sign of strength, not weakness.
Yep.
Talk to your healthcare provider, a therapist, or even a trusted friend. There are hotlines and support groups available to those who need them, and we will put some of those resources in the description below.
Yep. And I want to leave you with this. Postpartum depression is treatable, and with the right support, you can recover and thrive as a mom. You are not alone in this journey, and there is help out there, so don't hesitate to reach out.
Yeah. Now, that's going to be all we have for you this week. Thank you so much for watching. If you found this video helpful, please give it a thumbs up and share it with anyone who you think might need to hear this message. As always, subscribe for all the great pregnancy and parenting content to come.
Yes. See you next week.
Bye, guys.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.